Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. This week I had decided to skip the video because of hectic practice, ongoing academic conferences and other heavy schedules. But ultimately many of the patients had raised similar questions, so that's why an impromptu video with the not so proper setup. So I have decided to do this video. This video is for those parents who seek the answer. Why is my children getting sick so often, especially after the pandemic now? We have to understand the reasons behind this so that we are not unduly worried and we are not unnecessarily overdoing things. Okay. Anyway, we have to understand this in concepts very clearly explained. So this might take a bit long. Stay till the end of this video to understand about this. Especially this has happened post-pandemic. So my kid is getting diseases too often. He is becoming sick too often. What is happening? Just rewind the clock back by 1 year. What was happening during the peak pandemic to your kids? They were all well. But there was no differences in the food they were taking, fruits they were taking, chocolates and sweets they were taking, ice creams they were taking, curd they were taking, milk they were taking. These are the things which usually the elders attribute to the kids getting frequent illnesses or frequent colds. But they were taking all these. So essentially this proves that these things are not the reason for the colds. Okay, we know pretty well that the colds are caused by viruses and bacteria, but not by these things. Got it. Why is it so often now? Post-pandemic, what has happened, especially in countries like India, we have now in full open mode, no longer in lockdowns. Lockdowns reduce the overcrowding. Now we are overcrowded. So in classes, in schools, in public places, we have overcrowding. So there is chance of exposure. We have pollution, which reduces your ability to fight infection, which induces damages in your respiratory tract so that it is more prone for infections. We have lack of ventilation, especially in modern classrooms with air conditioners, with 40 to 60 kids stuffed inside a small room with all windows closed. Think just for 1 minute, if one kid has a simple common cold in a closed room full of 60 kids packed together, tomorrow or day after tomorrow, probably 10 or 15 kids going to get that infection. And finally, in developing countries, what we lack is lack of personal hygiene. Some of you might get offended. Don't just listen to this for a bit. What about cough hygiene? What about cough etiquette or sneezing etiquette? What about hand hygiene? Recently, when I said these same words to one of my patient's parents, he said, "No, all this was fine during COVID pandemic. Why do you want to continue all this even during normal times?" No. Cough hygiene or a sneezing etiquette is needed to prevent infections, whether it is just a simple common cold or whether it is COVID-19, from spreading one person to other. Covering your nose and mouth when you cough, sneeze is the basic etiquette to be followed at all times. Now it is not just essential to cover. If you are going to cover with your bare hands, you can't use these hands when you are interacting with others. Hand hygiene also becomes essential. So these are the bare minimum. First, we identified that these things, your foods, fruits, sweets, these are not causing colds, but peculiarity of developing countries like overcrowding, pollution, lack of ventilation and lack of personal hygiene contributes to this. But what about season, sir? No, the season is the worst. Winter season is the reason for all colds. There is seasonality for diseases, there is seasonality for common cold, there is seasonality for flu. But the seasonality is, in this season, these viruses are more in number. In summer, the viruses causing diarrhea are more in number. In winter, the seasonality, or in rains, the seasonality for flu is higher. Doesn't mean the season itself, the lowered temperature or the rain itself is contributing. It is the viruses. For example, even in these seasons, if we follow the etiquette properly, you will not get frequent colds. This we have to understand. It is not the season itself. Yes, there are some seasons which the diseases are more in number, but that doesn't mean even during the season we can prevent by following these personal hygiene protocols. And finally, what about immunity, sir? So some kids have higher immunity, some kids have lower immunity. That is the reason why my kid is getting illnesses very often. We have to understand immunity is not a God-given complete package that we are born with. Immunity doesn't prevent you from getting infected. Immunity allows you to fight those infections effectively, efficiently. And without getting exposed to illness, we are not already immune to these illnesses. For example, when COVID-19 came into being a new virus, no person was immune. We got personal protection measures. We got immunity after getting vaccines. Okay. Those who are immunodeficient were not able to fight better. Those who were immunocompetent were able to fight better, but they also got the infection. So getting the infection and having the disease itself doesn't mean you lack immunity. It is how you fight the disease. Okay. So we got this. Okay. Somehow one episode of cold doesn't prevent the other. Why? Because these are caused by different viruses. Cold is not a disease. This is a symptom of many diseases. Even corona causes cold. So having one cold will not prevent you from getting another cold due to another virus. And these immunities are not absolute. For example, take an example of myself. I got typhoid, I got treated with admission, intravenous antibiotics, all such things. I am getting discharged today. I go straight to a hotel. By the way, typhoid is spread by food and water. Okay. So anyway, I go to a hotel, I get food, they give me water which has contamination with typhoid. Will I get it or not? Even though I have been treated in the best possible way. So a treatment will not prevent you from getting further infections of the same disease or a different disease. Treatment is not preventive. So then what is preventive? Preventive is your personal protection measures or vaccinations. You don't have vaccinations for common cold. Okay, all this is fine. But my neighbor's kid has lesser number of infections than my kid. What about this? True, but understand it from their point of view. Go to your neighbor and ask them, probably they also know my kid is getting more. This is because of your affection towards your kids. Your illnesses, your kids' illnesses seem a little bit more. I understand it completely. But even otherwise, kids and adults both have different threshold. Each individual is different. For the same amount of illness, sickness, problems, each person reacts differently. A kid might be having cough, might be having stuffiness, might be having even fever, but that kid will be playing. Some other kid with slightest of nasal irritation will be complaining or whining to their parents. This is the attitude of kids. I'm not saying this is right or wrong. Similarly, parents. Some parent will allow their kids to undergo all this torture without giving any solution. Some others, at the stroke of smallest of things, with 2 sneezes, with 3 coughs, they will be worried, oh, is something bad happening to my kid? I'm not blaming these 2 approaches, to each his or her own. But it doesn't mean that the other kid is not having anything at all and your kid alone is suffering. And secondly, there is always glorification of the past. No, I haven't seen these illnesses happening in the past. In the past, everything was hunky-dory. Now all these diseases have cropped up. Check reality. Go to the past. Look at the facts. Look at hard statistics. What was the health statistics 1 or 2 generations ago? What was their life expectancy? They were combating severe diseases. They had much more number of infections. They didn't even bother minor infections. They allowed these persons to suffer through this. Their mortality rate was much higher. Roughly, if you put it simply, those days, if 100 people were born, only 10 people were living to their old elderly life, and there was 10 people, survival of the fittest. They were all fine, they were having their teeth well, they were all walking, healthy. Today 90 people are proceeding to that elderly life. Okay, they have arthritis, they have teeth problem, they have infections. Okay, what is the problem? We have saved 80 more. So today's health parameters are much better than the past. We are just glorifying the past without any scientific rationale. And finally, a word about allergies, asthma and wheezing. If your kid is getting frequent so-called colds, it might be that the child has allergy, different from an infection or triggered by the viruses itself, viral infection itself. So other kids might be having smaller number of days the problem, these kids will be having more number of days, but that might be due to not the infection but due to allergies. And allergy is not a lack of immunity, it is in fact an hyperimmune state. It is a over immunity but in a slightly wronger direction, and you can get this definitely treated, but don't attribute this to lack of immunity. So what we have today is, whenever our kids, especially our kids, not ourselves, our kids suffer from frequent infection, there is this notion of lack of immunity. Am I doing something wrong? Is it due to some food stuff? What is happening to present generation? This season is bad. All these stuff happening without realizing the true scientific facts and actually preventing by way of improving personal hygiene, cough etiquette, hand hygiene. So these things play a greater role. When you are sick, when your kid is sick, they are not supposed to go to a public place. I see kids in kindergarten going to schools with fever in the morning, with profound cough and sneeze. Next day, 10 of his friends also are going to suffer due to this. Why? I asked those parents. They reply, no, they will miss. Already my kid missed pre-KG because of the pandemic. So at least let him go to junior KG. Okay, this is the level of understanding that we have, and we blame it on many number of factors, but miss upon the true factors. After this video, probably you would have come to the conclusion that why you get frequent colds, and by getting frequent colds itself, it's not a so dangerous disease, not a so dangerous problem. I'm not saying you should not get treated, but getting treated frequently is not a big deal. Hopefully, this would have alleviated your fears. We'll meet you soon in next video. Thank you.